Good day, everyone. Welcome to another episode of the Circle Direct podcast, the podcast where we seek to explore essential health topics to help you better understand your body and the challenges that you would face regarding each of these conditions that we discuss here. I'm your host, Dr. Tiwa, and today we're diving into a very complex and often misunderstood condition called polycystic kidney disease. Now, for people that have been diagnosed with polycystic kidney disease, or in short, PKD, or have a loved one with this condition and are simply curious about it to see what steps to take or how better to understand the condition that they have been diagnosed with, this episode seeks to provide you with that information and much more understanding of what PKD is, how it affects your body, symptoms to look out for, how it can be managed, and things you need to know about it. Let's get started. So what is polycystic kidney disease? It's in the name, polycystic kidney disease, PKD, polycyst, that is multiple cyst. It is a genetic disorder where clusters of cysts develop within your kidneys. Now, these cysts are typically fluid-filled sacs that lead to your kidneys expanding and enlarging. And after a while, they tend to replace your kidney tissue, ultimately reducing the kidney function and lastly leading to kidney failure. Now, PKD also can cause other complications or problems such as increasing your blood pressure. Cysts can also develop in your liver, and then problems can also arise with the blood vessels in your heart and in your brain. Now, these cysts that develop in your kidneys in terms of polycystic kidney disease, they are not cancerous. But the fact that they grow and multiply is what would lead to much more serious complications. Now, in polycystic kidney disease, we have two types. First off, we have what is called an autosomal dominant PKD, typically short ADPKD. Then we have an autosomal recessive polycystic kidney disease, which is ARPKD. Now, for autosomal dominant polycystic kidney disease, that's ADPKD, this is the much more common form and it manifests in adults. It is called dominant because one parent tends to have the disease, and that one parent having the disease can lead to it being passed down to their children. There's 1 in 400 to 1,000 people that have ADPKD. As for autosomal recessive polycystic kidney disease, ARPKD, it is much more rare and usually appears earlier in life, often during infancy or even in the womb. And both parents must carry the gene for it to be inherited. Another example of an autosomal recessive gene that's common in our landscape is sickle cell disease, where both parents have to have that trait for it to be inherited by the child. What causes polycystic kidney disease? As we've stated earlier, it is a genetic disorder, meaning it is passed down through families. Meaning, since it's genetic, it means there's mutations in the genes that regulate your kidney function. Now, in autosomal dominant polycystic kidney disease, the mutation occurs in two genes, PKD1 and PKD2. Now, compared to PKD2 mutations, people with PKD1 mutations tend to experience more severe symptoms and faster progression to kidney failure. Meanwhile, in autosomal recessive polycystic kidney disease, the mutation occurs in a gene called PKD1. Now, the symptoms of ARPKD can appear very early, as stated before, even in fetus, and tend to be more aggressive than ADPKD. So, in summary, for ADPKD, that is the autosomal dominant polycystic kidney disease, PKD1 and PKD2 are the mutations that occur. But PKD1 is the one that has the more severe symptoms and has the faster progression to kidney failure. Meanwhile, in autosomal recessive polycystic kidney disease, the mutation occurs in a gene called PKHD1, and the symptoms of autosomal recessive polycystic kidney disease, ARPKD, appear early, even in fetus, and have symptoms that are more aggressive than the autosomal dominant polycystic kidney disease. So as we've already stated earlier, depending on what we talked about with the mutations, the symptoms of PKD, polycystic kidney disease vary depending on the type and the severity of the disease. But the most common symptoms across both types is high blood pressure, because the cysts tend to enlarge the kidneys and put pressure on the surrounding blood vessels. This leads to chronic hypertension, which is one of the earliest signs of polycystic kidney disease. Other common symptoms that you could watch out for are pain or discomfort in the abdomen, back, or your sides, kidney stones, that is because of abnormal kidney structures and maybe impaired filtration. You might see things like blood in the urine, that's hematuria. This occurs if the cysts in the kidneys rupture. Frequent urinary tract infections also can occur in patients with autosomal dominant polycystic kidney disease. And as this polycystic kidney disease progresses, it can lead to much more serious complications: kidney failure, liver cyst, aneurysms or bulging blood vessels, particularly in the brain, that can lead to an increased risk of stroke. Then we also have diverticulosis or small bulges in the colon, which is also a complication, although rare, needs to be discussed for you to understand that that can also happen in a patient that has polycystic kidney disease. Now, it's important to mention that patients with autosomal recessive polykidney disease can cause significant issues to the kidneys and lung development in newborns, often leading to life-threatening complications early in life. So how can we investigate, or how can we diagnose polycystic kidney disease? Now, during the clicking of a patient, if someone in their family has a history of polycystic kidney disease, the first step often involves screening. The most common diagnostic tool are imaging tests like ultrasound, CT scans, or MRI to visualize the structures of the kidneys. This will allow the doctors to see if there are any cysts that are in the kidney, and whether the cysts have started to form or become larger, or how these cysts have become in your kidney. Secondly, genetic testing to confirm the presence of PKD mutations in addition to imaging. This is especially helpful for families where the diagnosis is unclear, or for couples that are planning to have children. Once polycystic kidney disease is diagnosed, regular monitoring is crucial. Kidney function tests, blood pressure checks, urinalysis, imaging are all part of ongoing care for a patient with polycystic kidney disease. Monitoring is especially important for controlling complications like high blood pressure, which is a significant factor in the disease progression. So in terms of treatment for polycystic kidney disease or PKD, unfortunately, due to its genetic component, there is no cure for PKD. However, there are treatment modules that exist to help manage the symptoms and slow the progression of disease, as well as prevent complications. Now, what are these treatment strategies? First off, you have to control your blood pressure. This is perhaps the most crucial part of polycystic kidney disease management. For people that are Black or African, Afro-Caribbean, medications for hypertension such as ACE inhibitors or ACE receptor blockers are commonly prescribed to keep the blood pressure within a healthy range. Pain management also is crucial, because for people that are experiencing kidney or abdominal pain or back pain, things like acetaminophen are typically recommended for them to help manage the pain. However, NSAIDs, that is non-steroidal anti-inflammatory drugs, should be avoided because they can worsen kidney function. Thirdly, kidney function support. Because kidney function will decline in the later stages, dialysis may become an option for a patient with polycystic kidney disease, or even a kidney transplant. So in addition to medical treatments for polycystic kidney disease, lifestyle modifications are incredibly important to managing the condition. For example, maintaining a healthy diet, reducing your sodium intake, which is also crucial in hypertension management actually, and following a kidney-friendly diet is essential. That is, you have a balanced diet of fresh fruits, vegetables, whole grains to help manage your blood pressure and overall kidney health. Stay hydrated. Drinking plenty of water reduces the risk of kidney stones. That is a common complication of polycystic kidney disease. Regular exercise, physical activity helps manage your blood pressure and promote your general well-being. Avoid smoking and limit alcohol intake because both can increase the strain on your kidneys and should be minimized. In conclusion, in terms of living with polycystic kidney disease, it is certainly challenging, especially when you hear, oh, there is no eradicative treatment for polycystic kidney disease. Yes, there is no eradicative treatment, but it can be managed. So it is important for many people that know or that are living with this condition that it is possible for them to lead and have fully productive lives. It is all about managing the condition, especially hypertension, making sure that the kidney function is preserved, eating properly, doing the physical exercises that are very beneficial for you, and just to manage your overall health, because this can make a significant difference in your quality of life. People that are managing with polycystic kidney disease can engage in community groups, both online and in person, sharing this information of this condition with your family and making sure that they understand that they are not alone in managing or in the treatment or controlling of this condition. If you or someone you love is living with polycystic kidney disease, it is very important for you to build a strong healthcare team and stay informed about the latest research and the latest treatment options that may be open to them. And also make sure for them to understand that they are not alone, especially if it's someone you know, they're not alone in the managing of this condition at all. That brings us to the end of this episode of the Circle Direct podcast. If you have any questions regarding this condition, please do leave them in the comment section below. We'll be glad to get to them and answer any pending questions that you might have. We hope that you stayed informed and you continue to be proactive with your health. Until next time, I bid you goodbye. I remain Dr. Tiwa. See you some other time.